Do friends avoid you because you have to tell them you have to lose weight?
Always 2 brains is better than 1 brain.
Is it possible to dance immediately within 24 hours after robotic surgery?
So end of the day, what does robot does for us is the margin of human error is decreased.
So welcome to the program, doctor, and it's a pleasure to have you.
Thank you for the invite. It's pleasure is all mine to start again. Yeah.
So tell me honestly, what's tougher, operating or fixing the bones in the OT or doing or navigating podcasts, mics and cameras links?
Navigating podcast is a little bit new for us since surgeries are very monotonous but routine, but we enjoy it.
Is it true that orthopedics usually win every arm wrestling match what they can do?
It's not an arm wrestling match when you have a passion for the surgery. So it's like playing a game. So every game is enjoyable, challenging, and when you win that game, you feel enthusiastic to do more.
So I'm sure one of the most common questions you get to hear is, doctor, are my knees okay? So why is that, everybody gets a problem with the knee?
First of all, the knee is always the starting symptom for everybody because it is a weight-bearing joint. And it is every weight-bearing joint whenever the patient or the individual goes old or when it starts getting degenerative. It starts with mainly the knee joint and the foot and ankle. And thereby it progresses to the hips, spine and everywhere. But it need not be a dictum that it should always be starting with the knee. But there are instances where it can start with the shoulder or the fingers as well.
Weight bearing joint ante okati gurtochindi. I mean, do friends avoid you because you have to tell them you have to lose weight?
See, as per the studies or evidence, as they say, like in Caucasian population, like in US or Europe, there are patients, we call them whales, like about 200, about 250. But they generally are very not so symptomatic for the knee arthritis. It is basically BMI or body mass index has some correlation with the knee arthritis, but not every heavy patient has a knee arthritis. If it's like having a car with the tires being worn out and you're asking them to drive more. So it is not possible. So what I tell to them is have a healthy life, have a good sleep. If you can do exercise, yes, you can do like swimming, like something which doesn't bear much of a force or stress on the joints.
So someone diagnosed with knee arthritis, be it at any age, are there any non-surgical methods that you would suggest before taking them for surgery?
Knee arthritis, if a stage of knee arthritis is stage 1 or stage 2, yeah, we can give. It's like telling a bald person, so giving them pain management is no use. So stage 3, stage 4, stage 5, patient is not able to execute their daily living activities. రోజువాటి పనులు నేను చేసుకోలేకపోతున్నాను అంటే yes, they come under relative indication for surgery. లేదు, నేను నా రోజువాటి పనులు చేసుకోగలుగుతున్నాను. I am able to execute 70 to 80% of the work. Then we can offer them pain management protocols.
Okay, now let's shift gears. Let's talk about robots. Robotic knee surgery ante, I mean, most of us imagine a tiny R2D2 assisting you in the OT. Asala robotic surgery ante enti?
It is not general dictum like in a media hi-fi. Robotic surgery is some robot machine will come and you will be sitting back and robot will be doing. That is not the case. This is robotic-assisted knee replacement. When the word assisted is in a hyphen, bold letters underline.
That changes everything, huh?
That changes everything. Of course, human is always there in the loophole. Robotic-assisted means mainly what it gives us is, my mentor used to say like always 2 brains is better than 1 brain in a surgery. Robotic-assisted, what happens is the cuts are basically the bone cuts will be very small, it's precise, and blood loss will be very less. And basically whatever you're going to change, modify in the replacement or the measured resection will be calculated by the robot. And the cut will be very precise, boundary based, because it doesn't give us the margin of error will be very less. So end of the day, what does robot does for us is the margin of human error is decreased.
The doctor is still the master of the surgery and
he'll be the captain of the ship. So he can take the decisions, only the robot will be assisting us.
Is it also true that suddenly most of the people are asking for robotic knee surgery? Why is it? I mean, is it because of accuracy or faster recovery or awareness?
Why they are asking, ఇప్పుడు కొత్తగా రోబోయే కావాలని ఎందుకు కోరుకుంటున్నారు అంటే basic thing is costing. So the costing between a conventional and a robotic margin has come down drastically. Whenever you want a new thing with a negotiable price, they are opting for that.
Is it possible to dance immediately within 24 hours after robotic surgery? Is it true?
Yeah, of course, you want to dance to show off the world. Yes, I did it 80% got this thing. Yeah, you can do that. But coming to the sanity part, I don't think so. We should stress the body to that extent. Yes, as medically it is possible. But should we stress it? I don't think so.
So what are some common misconceptions or myths that you get to hear about or patients ask you as far as knee health or robotic surgery is concerned?
Most common question what we get is, దీనికి టాబ్లెట్స్ ఏమైనా వేసుకోవచ్చా, ఆర్థరైటిస్ ఈ కీలవాతానికి టాబ్లెట్స్తో ఏమైనా నయం అవుతుందా? ఇక్కడ టాబ్లెట్స్తో నయం అవుతుందనే మీనింగ్ ఏంటంటే, మీకు తెల్ల జుట్టు వచ్చింది, నేను టాబ్లెట్ వేసుకుంటే నల్లగా అవుతుందా? Is it logical? No, it is not logical. But medicines curing the knee arthritis అంటే stage 2 నుంచి stage 0కి వస్తుంది అంటే it is not logical and not possible also.
So what are some daily secret things that we would be doing and hurting our knees which we wouldn't be really aware of?
One thing is, if it is like horses of courses, if your knees muscles are not strong, when they are not strong, don't stress it. You're asking a Fiat car to run like a Ferrari. It is not possible. Suppose you take an athlete who runs a mile, who practices to run a mile in certain time. He's an athlete. He has a strong muscles, strong leg muscles. There's no limit for his knees not to do so, other than injuring himself. Yes, traumatic injuries can occur in sports injuries when undue pressure is affected. Now that is injury, that is trauma. There is nothing wrong with his knees unless his muscles are like in a good condition. If muscles are not in a good condition, you are asking that individual to sit on the floor, బాసపెట్టి కూర్చోండి ఎక్కువసేపు, పూజలో ఉన్నారు, లేదంటే స్టేర్ క్లైంబింగ్ మీరు ఎంతైనా తిరుపతి మెట్లు ఎక్కండి, లేదంటే ఏదైనా ఎక్కువ దూరం పరిగెత్తండి, మ్యారథాన్, యు గో ఫర్ ఎ మ్యారథాన్, రన్ చేయండి. If muscles are not strong, most of the pressure will be on the joint. We call that joint reaction forces.
Are there any superfoods which makes your bones stronger?
I only believe you have to have a balanced food, and that balanced food should have all the nutrients. They say, మేము రోజు కాల్షియం తీసుకుంటామండి, కాల్షియం టాబ్లెట్స్ వాడుతున్నాం, మా బోన్స్ ఎందుకు? కాల్షియం తీసుకుంటే అది బ్లడ్లోకి వెళ్తుంది. బ్లడ్లో ఉన్న కాల్షియం బోన్కి వెళ్ళాలనే ఆస్కారం, అది స్టిమ్యులేషన్ ఆఫ్ ది బోన్ మధ్య ఉంటుంది, లేకపోతే లేడీస్లో ప్రీ మెనోపాజల్ వాళ్ళకి ఈస్ట్రోజన్ హార్మోన్ ఉంటుంది, అది కాల్షియం తీసుకుని వెళ్తుంది. సో వాట్ ఐ అడ్వైస్ టు దెమ్, rather than concentrating 1:10 about diet, you have to concentrate 1:10 about exercises. Yes, be disciplined about your diet.
What's your secret mantra for a healthy lifestyle?
I follow exercise. That gives me a peace of mind. And good sleep, good family time.
So before we wrap this episode, doctor, is there any message that you would like to share with our audience out there?
Healthy bones is always regards to the exercise. The more amount of exercise you do in your lifetime, it is going to reap you 100 of benefits. The more amount of exercise, more the better.
So thank you, doctor. It was a pleasure interacting with you.
Thank you, Lakshmi. Thank you for the invite once again. It's been a very healthy discussion. So I'm hoping for in the future we'll get to something like that. Thank you.